Every year, millions of people are diagnosed with cancer, but for most of them, the cancer is already too far gone. By the time symptoms appear, tumors have often spread. And treatment becomes a race against time. Cancers like pancreatic, ovarian, and lung cancer are called silent killers for a reason. They grow quietly, hiding deep inside, until it's almost too late. So here's the question. What if we could detect cancer before it even shows a single symptom? From just a few drops of blood? Traditional screening methods, mammograms, colonoscopies, CT scans, have saved countless lives, but they come with limitations. They're designed for specific cancers, require multiple hospital visits, sometimes even anesthesia, and they can't screen for every type. That's why, despite all medical advances, late detection still remains one of the biggest reasons people die. Cancer. If we could catch cancer early, survival rates could shoot up by 20% to over 90% in some cancers. That's the power of early detection. Imagine detecting cancer, but through a simple blood test. This is what we call a liquid biopsy. Every tumor in the body sheds tiny fragments, bits of DNA, RNA, proteins, and even microscopic vesicles, into our bloodstream. Scientists call these fragments circulating tumor DNA, or ctDNA. By analyzing this genetic material, we can detect the unique molecular signature of cancer, sometimes even before a tumor shows up on a scan. A blood sample is taken. From that, special machines extract billions of DNA fragments. Our DNA isn't just a long code. It's also decorated with tiny chemical tags called methyl groups. These tags act like switches, turning genes on or off. In cancer, this normal pattern of DNA methylation gets disturbed. Some genes that should be silent get activated, and others that protect us get shut down. Scientists use next-generation sequencing, or NGS, to read millions of these DNA fragments at once, like scanning an entire library in seconds. It allows them to spot those abnormal patterns, a molecular fingerprint that only cancer cells leave behind. For example, in lung cancer, a liquid biopsy can detect EGFR mutations. Think of EGFR as an antenna on your cells that receives growth signals. Normally, it helps cells grow only when needed, but when it mutates, that antenna gets stuck in the on position, making cancer cells grow non-stop. And the best part is, doctors can detect this and choose targeted treatments without even touching the tumor risks. And unlike tissue biopsies, which sample just one small part of a tumor, liquid biopsies reflect the whole tumor's genetic landscape, and even multiple metastases. But the real magic is detecting cancer before it strikes.